hypothyroidism or thyroid disorders, dealing with glucose metabolism or diabetes, these kinds of things, but these are nutraceutical. So these are prescription nutrition. And I have my patients take these kinds of things to get a very effective and very quick result. Because I want to see some change. I want them to see the change quickly. And the change is not a Band-Aid. The change is not treating their symptoms. The change is actually treating the underlying cause, the problems that they're having, the deficiencies that they're exhibiting, directly treating the underlying cause. And this is one of the differences between the approach that we take and the conventional approach. The conventional approach is treating symptoms most of the time, like 99% of the time. All right, so what we have here are Nutrimetrics, Metagenics, and PM International. These are the links on the practice website. All right. So if I start with taking a look at Nutrimetrics by clicking on the link, you can see a bunch of these on here. Now, then there's, if you scroll down, you'll see Nutrimetrics again, if you have access to it. Now you can pull this up on a smartphone, you know, iPhone or Android, and or on a computer, right? So, all right, so taking a look at that, Nutrimetrics, you can go into the environment by clicking on Nutrimetrics again if you've scrolled down, and that gets you to the environment. You can do a search and take a look. So with that, let's say we want to look up, let's see, multivitamin with iron, okay? So I type in multivitamin, and then I just type in iron. And in that search, I pull up some combinations as well as a single bottle of a multivitamin with iron. Okay. Now, one thing to know about the majority of Nutrimetrics nutraceuticals is that they are isotonic. And isotonic is by far the fastest, most effective way to get this nutrition into your body, aside from somebody sticking a needle in you. So, you know, orthomolecular medicine is an area that I practice. It's part of the scope of my practice. Orthomolecular medicine is treating an individual for their condition by addressing underlying nutritional deficiencies for the most part, sometimes excesses, but most of it is deficiency. And it has become kind of commonplace for the public to, if they know anything about orthomolecular medicine, to think that it is always tied to intravenous methods of getting the nutrition into your body. That is not the case. In fact, the closest method, the closest approach to IV without using a needle is through isotonics. And when you use an isotonic, it gets into your body very quickly because the mechanism is such that it is isotonic. What that means is it's the same pressure or the same texture as body fluid. So it's looked at as body fluid, and the sensors inside your stomach will detect it and detect it as body fluid. Why that's important is because digestive fluids or body fluids are treated or trigger responses that are different from other fluids. And what happens is the bottom sphincter of your stomach will open up in response to an isotonic. And why is that important? Well, because the nutritional substance isn't sitting there being digested over hours and maybe partly being broken down and partly being absorbed through that process in the stomach. What happens is it's bypassing the stomach, going right into the intestines. So through the intestinal wall, the nutritional substances that we're trying to address are being absorbed right into your bloodstream. So through this method, 95% of the nutrition is about the average statistic, is available within approximately 5 minutes. Now, I tend to ask people to take about 15 minutes just to make sure that additional 5% is in there. So you can get virtually 100% absorption in a very, very short time. This is why this is very close to IV administration, which intravenous, if you're not familiar with the term IV. So intravenous, using a needle to put the nutrition into your body, is another method that's used. It's kind of, obviously it's more invasive. It's a little more drastic approach. Whereas you can, through isotonic administration, get effectively the same result and the same kind of administration, just without the needle. So these are isotonics that I'm talking about, and Nutrimetrics is the specific kind of isotonic that I use in the practice. That's one of the main approaches that I take in the practice because it's extremely effective. Now, if you would like to do some of this on your own, you can certainly go to our website, as you may have already done. And on the home page, you'll find there is a link to a test you can do if you'd like to try that. And I'm going to take another look at it. Okay. So if you go to the home page, naturalhealthbydrjackson.com or www.aptw.net, which is short for Path to Wellness, you will see that there is a link. I'm trying to find it actually. At the bottom of the home page, near the bottom, actually kind of in the middle, there's a lot on the media and so on. Been on TV a lot lately and this kind of thing. So there's a section that says, click here for a complimentary nutritional assessment. So you can click there, and then that should take you to a nutritional assessment. And I see right now that the link has been changed, so we're going to have to update that. But you can do this nutritional assessment and see what is being recommended to you. Okay, and then you can go through that process of selecting the items that are being recommended through the site. And that's a start for you if you can't get in to see us very soon or this kind of thing. So all right. So isotonic delivery is one of the methods that we use in the practice to get excellent efficacy. And if you're looking at some of the items on that site, you'll see that with the Nutrimetrics link, you'll see that they go through some rigorous testing, and you can look into the research as well. There's a lot of research on the site. But additionally, you'll also see on majority of these that they have been analyzed and shown not to have any GMO substances. So there's no detectable GMO or genetically modified organisms or genetically modified substances in these nutraceuticals. Okay, and I won't get into why that's important, save it for another show. But what I'm trying to emphasize is the effectiveness, and that this is a great choice for you to address any sort of nutritional deficiency. What I'm finding is that there are some very common nutritional deficiencies. Iron is quite common, but occasionally we'll find an individual who actually has excessive iron. For example, the condition hemochromatosis. So it's important to know that it is a need that you're addressing. It's also very common in Florida, believe it or not, to see vitamin D deficiency. Very common. And this is counterintuitive. But if you think about it, 10,000 years ago, we were running around without clothing. So we were getting full exposure. Now we cover up our bodies, and that's covering up a lot of the areas that would be exposed to the sun. And this is part of how our bodies generate vitamin D, is through the cholesterol conversion from our skin through our body, through our liver, our kidneys, and so on. And so another aspect of this is that we're being told to use sunscreen. And so people are covering up with sunscreen any areas that are exposed. So you're not getting the vitamin D generated in your body. And then there are deficiencies linked to the creation of vitamin D within your body. You may have certain enzymes lacking and things like that. So the conversion process may not be happening, even if you get some generated from the sun. Your cholesterol might, nowadays there's a lot of reduction of cholesterol to the point that a lot of individuals are being brought below the level of a total cholesterol of 100, which is becoming fairly common. And there are some legitimate concerns as far as cardiovascular health. However, it affects other aspects of your body, like the creation of hormones. And actually, vitamin D is a hormonal substance as well. So that's affected that way. But the creation of vitamin D starts at the skin, inside your body. And cholesterol is used to convert to create that vitamin D. So if you're too low in cholesterol, you may not be able to create enough vitamin D. So there's important aspects of everything that we do that can affect these things. So, all right, so I've probably given you quite a lot to think about already. So let's go ahead and take a little break, and then we will return and talk more about some of the approaches we take to treating with nutrition. It's called orthomolecular medicine, and really getting to the root cause. So you're listening to A Path to Wellness on WSPF-DB.com. to Wellness on WSPF Digital Broadcasting, WSPF-DB.com, and RhinoOnAir.com.
And this is Dr. Christopher.
And this is Dr. Christopher Jackson, PhD, DOM, Florida, and working on another PhD, by the way, almost there. That actually kind of brings up a point. When I talk about treating individuals with nutrition, treating them for nutritional deficiencies, the PhD I'm working on right now is focused on behavioral medicine. And what that means is that I'm researching underlying causal issues in the physiology of individuals that lead to behavioral or psychological disorders. And quite often these are addressed simply psychologically, but that doesn't get to the root cause. And that's what I'm trying to do. This has been my entire focus in my practice, is getting to the root cause. And that's one of the inspirations for doing this particular PhD, is to get into the underlying causes of not only physiological disorders, which I've been doing all along, but psychological disorders as well. And again, this is an example. If you want to compare, conventional approaches are treating symptoms. They're addressing theoretical underlying causes sometimes, like the theory might be that somebody is low on serotonin, and therefore you give them a serotonin reuptake inhibitor, and that will help to elevate the serotonin and therefore help them have that feel-good sense. Or dopamine agonists, helping to promote more dopamine, which is kind of a get up and go hormone. It's kind of something that motivates and helps us be motivated throughout our day, and especially in the morning. So these kinds of substances are sort of directed toward underlying cause, but okay, so say somebody's low in that, why is that, right? So that's really getting to the root causes when you look at what's underneath that. And I can give you an example. For example, if somebody is magnesium deficient, quite often magnesium leads to, if they're deficient in magnesium, leads to them lacking in the production of dopamine, you see, or serotonin. You can look at the underlying things that lead to those deficiencies. All right.
So what happens if you're somebody low in magnesium that has created, so what does
quite often that magnesium deficiency leads to depression. Yeah. It can be many things. In fact, we were talking about vitamin D, seasonal affective disorder, which a lot of people have from Starbucks country up in Washington and all around, in the areas that don't have much sun. The seasonal affective disorder is essentially a depressive disorder. Affect, meaning the manifestation of their personality and their behavior, in the sense that they don't respond normally to social circumstances, like negatives may be over responded to and positives may be under responded to, for example, leading to a flat affect.
I know some people that can prove the point.
So there's physiological reasons for these things. And this is what I'm trying to get to, just like I do with the physiological disorders. So, see, nutrition can be used to treat all of it. And this is kind of the fundamental point of it all. Orthomolecular medicine is nutrition-based medicine. And treating the deficiencies that exist in individuals, especially deficiencies, as opposed to excesses, that was developed by a multiple Nobel laureate, Linus Pauling. He kind of cracked the eggshell there, and then others followed. including Abram Hoffer and others. A lot of it happening in Canada, a lot of that development. In fact, it has grown a lot with Canada being a lot of the motivating force behind the development of orthomolecular medicine, probably because of, political efforts by organizations like the AMA trying not to allow these kinds of things to affect pharmaceutical medicine and the business of pharmaceutical medicine. But that's a theory, okay, for right now. At least that's from me. But it's true that there is a business in pharmaceutical medicine. There's a business in the food industry and the drug industry, right? And in fact, there is an area of medicine now that has been recognized by the FDA, known as food medicine. So it's a kind of a crossover, and this kind of incorporates some of the herbal medicine. So there's a little crack in there that's happening that might grow into more understanding. And there are areas of medicine being practiced that grow from orthomolecular, such as functional medicine. Functional medicine looks at these deficiencies, as I've been mentioning, and tries to address these deficiencies. So there's a lot of overlap between orthomolecular and functional medicine. Let's see. Sorry, I'm trying to struggle with a name I was going to throw out there. This fairly well-known guy who initiated the functional medicine area, and I'm having trouble bringing it to my mind. But he has been a motivating individual in that whole area. It'll probably come to me and I'll mention it later. But again, the area of orthomolecular medicine, Linus Pauling was one of the founding fathers of. And Linus Pauling, one of his issues or discoveries that brought him to the forefront in this was the use of vitamin C. And he was the father of vitamin C administration to treat cancerous conditions. And it worked. Okay. So IV vitamin C has been one of the effective tools in treating cancer. And he had a lot to do with that. And this is back in the late 60s, early 70s, when this was all starting. Okay. So back to some of the tools that we use, the RX nutrition, as I call it, or prescription nutrition. So if we look again at the website for the practice, naturalhealthbydrjackson.com or aptw.net, which has been working up until this morning when I decided I was going to use it. You go to that website, and under RX Nutrition, the next choice after Nutrimetrics, which is all the isotonics, is Metagenics. And Metagenics is a very, very good nutritional or nutraceutical company. That's been some of the tools I've used in my arsenal for treatment of individuals with various conditions have come from Metagenics. For example, there is one called Thyrosol. I've used this quite a bit. Thyrosol is, as the name implies, for treatment of individuals with thyroid issues, okay? And how this works is to give you nutrients that that help with the conversion of sort of a macro hormone down to a microhormone that is the active version of thyroid hormone. So it helps your body work better. It helps your thyroid work better, or the conversion of thyroid hormone work better in your body. So that's a very effective approach to improving thyroid function, or improving the result of the administration of thyroid hormone. It's complicated to say this exactly right, because it's basically part of an overall feedback loop that includes the anterior pituitary gland and hypothalamus and all this stuff. So it's called the hypothalamus pituitary thyroid axis, and then there's the hypothalamus pituitary adrenal axis, which I also use some of Metagenics nutraceuticals to address adrenal function disorders, like if somebody is deficient adrenally. Okay? That can be one of the approaches that I take. So Metagenics has a wide range of these nutraceuticals, and Metagenics is more about, there's also some nutritional approaches. I would say that they are not as drastically effective for the most part as isotonics. However, in some cases they are. So I'm pretty selective about which ones I'm recommending to my patients. But there's also this added area where they have very targeted support for specific glandular functions and these kinds of things. And there are somewhat equivalent, not entirely equivalent, nutrimetrics versions, of nutraceuticals that address some of these issues as well. But I find that Metagenics, they have a range of products that work very well for specific needs that I have in treating individuals for various conditions. So if you want to take a look at those just out of interest, or you're thinking that you may have a condition that needs to be addressed, I am not encouraging you to self-medicate. I think that it is very good to find some way of really figuring out whether something is an issue before you start popping pills or taking substances. However, when it comes to specifically nutritional issues, there are ways of finding out about deficiencies beyond simply blood work and things like that. So, of course, in my practice, I'm doing this all the time, and I use these substances to treat various conditions, and very effectively. And the effectiveness is kind of inherent in the name nutraceutical, because they are essentially pharmaceutically derived nutrition. Okay, again, not over the counter. Right? You're not going to find this at the herb store, the vitamin store, or things like this. Okay. So we have from that site aptw.net or naturalhealthbydrjackson.com, drjackson.com. You can link from RX Nutrition to Nutrimetrics for the isotonics and for a range of other things that can be used. Like they have on the Nutrimetrics site, if you've been searching for a fish oil, and you've been searching for an effective, very potent fish oil to help bring down inflammation, to help improve your cholesterol ratios, get your HDL up, that kind of thing. Nutrimetrics has by far the best omega-3 combination I've seen, the most concentrated one I have seen in looking at all of them. And that includes some of the ones that I consider top-notch, like Nordic Naturals. Generally they're very good. Ultimate Omega is very good. This beats them. And that's from Nutrimetrics. So it's under the title of heart health. There's an omega-3 that's extremely potent. Very, very good. All right. So if we go next on the list, we have RX Nutrition, we have Nutrimetrics, Metagenics, and then we have PM International. Now, PM International is kind of an interesting combination because there are nutraceuticals that are very potent and come very close to being isotonic. I mean, in terms of the effectiveness, they're not really isotonic for the most part, but they work very effectively in the approach, which is through absorption through cilia at the surfaces inside your intestinal tract, for example. Very, very good. And they can approach the 95% number as well in terms of absorption. And I tend to use the PM International group of nutraceuticals more for people who are, like, for example, teenagers. You may have a teenager in the house. Teenagers tend to be large consumers of junk food, fast food, etc. They may not be eating very well. They may not be getting their nutrition properly, etc. Well, PM International has very, very good broad stroke kind of nutritional formulas that can address those deficiencies that they may have because of eating that kind of diet, to where you don't have to convince them to stop eating the fast food, although it's still a better solution for them to stop that and to eat better foods. But you can at least help to improve the situation by using these PM International formulas. So there's one called Activate that helps with getting up and going in the morning, and also has some B vitamins and vitamin C and this kind of thing. There's another one, comes in yellow packaging, I can't remember the name, but it has some vitamin D in it and has substances that are plant derived, like, mixes of vegetables that are plant derived within that formula and this kind of thing. So if they're not eating their vegetables and fruit, this is another way to deal with it. And then there are things like, they may be out on the field running, or they may be playing sports and using up their electrolytes, perspiring all day, go to bed and then have cramping in their legs or something like that. That is a sign of an electrolyte issue. And there's a formula that I use from PM International fairly often for addressing these kinds of issues. And that's called Restorate. Restorate is taken at night before bed, a few little tiny scoops, and it helps to address those electrolyte deficiencies or imbalances. So you see there's a range of these nutraceuticals that are used for different purposes and help to address these issues, these health issues. But all of that with an eye toward addressing imbalances or deficiencies, and in some cases excesses of certain substances. Now, how do you deal with an excess? Okay, that's interesting, because there are specific nutrients that draw down other nutrients. Okay, for example, if somebody has too much iron, they have hemochromatosis. Well, some of the nutrients, such as magnesium, manganese, calcium, can draw down or help your body to reduce iron if taken with a combination that is independent of iron, has no iron. So for example, a multi without iron can help you actually reduce the iron that is contained inside your body. So if somebody has hemochromatosis, obviously they don't want to be taking something that has iron in it if they have excessive iron in their tissues. This can get into the liver and other organs and cause at least the symptoms of other conditions like diabetes, rheumatoid arthritis, etc. They can look like, they can appear to a clinician that they have these other conditions. And yet, if that clinician checks appropriately for iron, they will find often that they have this excess of iron. And this is a condition, hemochromatosis, which can be congenital or otherwise induced. Like by diet, if you're eating spinach day in, day out, every day, all day long, and eating other substances that have lots of iron, you can end up with excessive iron. And iron has been associated, if in excess, with heart attacks and other issues, like fueling cancer. So we want to make sure that things are balanced, and that's part of getting to the root of everything, is looking for deficiencies, looking for excesses, and then addressing those in ways that are effective. So these can be chronic conditions, and in some cases, acute conditions. You know, in some cases, this is an urgent issue that needs to be addressed quickly. Well, using appropriate, very efficacious nutraceuticals, very effective nutraceuticals, we can get results quickly. I snap my fingers because it's like, you know, we want to get to it.
Pronto, rapido.
Yeah. Muy rápido, right? Yeah. So, or as, who was it? The cartoons, Andale, andale, yepa, yepa, riba, riba.
Pronto, Speedy Gonzalez.
Speedy Gonzalez, yeah. There you go. So,
Now we aged ourselves.
yeah, for sure. Okay. So, you see the approach. So, when I'm looking for root cause, looking for root cause is looking for deficiencies or excesses that are involved. Now, this may also include, like, you know, we do standard lab work, we do blood work, we do, you know, what's conventionally practiced all the time, which is using such as a CBC, complete blood count, you know, looking at differential analysis, looking at white blood cells, red blood cells, looking at platelets, these kinds of things, yes. We do a metabolic panel, be it a basic one or a complete one, where we look at liver function, kidney function, blood sugar levels, you know, looking at calcium levels, magnesium, things like that. So these are kind of basic panels that are used by everyone, right? Clinically. Hemoglobin, for example. Now here's an example for you. If you look at just hemoglobin, which is conventionally the practice, to look at hemoglobin to assess iron levels, right? Hemoglobin may indicate that everything's fine, yet I have found in practice several individuals whose iron levels were quite low, yet their hemoglobin was fine. So if you don't actually test the iron, if you go this sideways approach, which is conventionally the way it's done, you're possibly missing some people who have issues with iron. The same is the case for treatment of thyroid disorders, same idea. So, you know, with iron, they look at hemoglobin. Well, that's not iron. For thyroid, they screen using TSH, thyroid stimulating hormone. However, that's not thyroid. That's actually an anterior pituitary hormone that stimulates the thyroid. But that's not the thyroid. The thyroid puts out certain hormones, and you can look directly at those hormone levels as opposed to, you know, practicing by inference, basically, with TSH. And this is a problem. It's very well documented in research, especially lately, like in the last few years. There's a lot of research showing that TSH is way overused as a screen for thyroid, and we're missing a lot of people because of that have thyroid issues. So there are more effective ways to get to the root cause. And I'll just put that out there. And for those of you who may be healthcare practitioners, look into it. All right, so with that said, I've given you kind of a broad look at some of the ways that we approach things at Path to Wellness, and the use of nutraceuticals and how they're used. I'm not expecting you all to become practitioners and do this stuff on your own. However, it may be useful to a certain extent, and at least help you get a hedge on issues. But I do suggest giving us a call. So you can call the practice at 727-329-9637. Again, our website is usually working, www.aptw.net, short for Path to Wellness. Or you can try Natural Health by drjackson.com, Natural Health by drjackson.com, to get to the website. And we are located in Northeast St. Petersburg on 4th Street North in Florida, in Tampa Bay, Florida. And we do have people come to us from all over. So
Tampa Bay?
Tampa Bay.
You're in St. Pete.
Yeah, in St. Petersburg. Yeah.
Oh, okay.
I said St. Petersburg. Yeah. So, anyway, you've been listening to A Path to Wellness on WSPF-DB.com, rhinonair.com. Look forward to speaking with you later. I'll just update the website.